This is trigger point release for the neck and shoulders. If you've had chronic neck or shoulder pain or arm pain that a doctor hasn't been able to accurately diagnose or treat, it's likely that some or all of that pain has been caused by trigger points. We're going to show you the 4 most common areas and then teach you how to treat them and release them. For one of them, you'll need a ball, but for the rest, you only need your hand. One of the most common areas for trigger points in the entire body is in the upper trapezius muscle. And that's because of all the texting and computer work we do. So most people are going to have trigger points in this area, and they're really easy to release. Just use your thumb and forefinger, grab this bit of muscle that sits on top of your shoulder, move around your fingers, and most of you are going to feel a tender spot. When you do what we're supposed to do with trigger point release. Squeeze. If you're on it, it's going to get really intense for a second or two, and then it should relax somewhat. The pain should go down in intensity. It's very, very common when you squeeze this to feel pain up into the ear, the side of the head. That's all normal. Remember, hold it, breathe until you feel the intensity go down. Another common one, but difficult to reach one, is the Subscapularis. That's the muscle on the inside of your shoulder blade. So it's between your shoulder blade and rib cage. To get in there, you got to use your thumb, go in through your armpit, lie your fingers across the back, and try to get in there and pinch some of that muscle. Move your fingers around. Most people have trigger points in this muscle as well. Very uncomfortable. Also very common to feel pain down the arm when you find one. Now there are nerves in there, your brachial plexus is in there, so be careful. Make sure you're on a trigger point before you treat it aggressively. Remember, if the pain doesn't start to decrease in intensity pretty quickly, or especially if it increases in intensity over time, you're not on a trigger point, you're on something else. Get off of that. The third one is in the back of the shoulder blade, and there's a lot back there typically. We're going to just hit the whole area with our ball that we've used for trigger points. We're going to put it on the back of the shoulder blade and roll around. Start at the very top of the shoulder blade, work your way down. Very likely you're going to find something. You can also work on the inside of the shoulder blade between the spine and the shoulder blade. When you find one, lean your body weight into it, breathe. Again, you'll feel a dramatic increase to begin and then a quick decrease in pain. Yep. Okay, and the fourth and final one are called suboccipital muscles. Those are the muscles right in the base of your skull. And we are going to use the ball for this, but not the wall. We're just going to use the ball and our own hand's pressure because these are tiny little muscles. They don't take a lot of pressure. So we're going to put the ball at the base of the skull, roll it around, and you're going to feel these. You'll know it. They'll kind of refer up the skull, around the ear. Find them, same as always. Compress, breathe. You should feel a dramatic decrease in pain. Remember, can't overemphasize this enough. If you're on something and the pain continues to increase for several seconds, that's not a trigger point. Get off of it, move on to something else. Remember, change comes with commitment. Trigger point release is a difficult skill to master. Keep coming back to these videos and trying it. You'll get it in time. Never miss the latest videos from your Dr. Design fitness experts. Subscribe now.